All right, so this is for our good old PECs. So remember, with the PEC, that means they're stuck in extension in their pelvis, they're stuck in extension, their low back extensors are stuck, their rib cage is flared. So this is a good drill to help them find their obliques and find their lower abdominals ultimately. So what you're gonna do first is tuck under, a little bit more. So now we lined up pelvic floor with the diaphragm. Now push through a little bit. Now we got serratus anchoring for those obliques, right? Soften your elbows slightly while maintaining this position. Right there is good. Now let your nose go over your fingertips. So rock forward and hold that position. Tuck a little harder. Now breathe. Inhale through the nose. Exhale, close the rib cage. There you go. Inhale through the nose. You'll feel posterior mediastinum expansion. Full exhale, you're creating compression. There you go, that was a good one. And then full exhale. More exhale, more exhale, more exhale, more exhale, more exhale. Don't come back. Tuck, and then slowly inhale. So that's a good starting point for somebody that doesn't have abs and doesn't know how to get in a position to create compression in the abdomen. But see how such a simple position can create so much neural drive to the abdominals? Okay, now we're gonna take it a little bit deeper. I'm gonna have you go rocking forward, setting everything you just practiced, so tuck under a little bit more aggressively right there. Just take one breath in, full exhale so you compress both rib cages down because it's a bilateral motion. Now don't lose posture, tucked under, take your left hand off the ground.
Oh dear.
Just like this, just straight up, and hold. Now you feel the tension of this knee supporting that hand. Now we got some cross-referencing going. You're breathing. Good, and that's where a simple drill can blow somebody out of the water. And this ain't even it yet. Now go ahead and switch, other arm, sense the difference. Now we got tripoding.
What am I doing?
Yeah, you try to do a bird dog. This ain't bird dog. Good, tuck under, breathe in. Good. Now watch this. Start to reach with this arm. Now we're gonna drive some lateralization. Reach, inhale. Exhale, close. Close this. Now watch this. Feel my knee here? Abduct into my knee. Now we got a right glute max. Now squeeze this in. Now you got an adductor on the left. Do you feel that? Now take a big breath in. And then full exhale. 3, 2, 1, inhale. And the rest. So that's where, if we just know the pillars of what we're trying to do, we could turn all these drills into like crazy drills.
It was definitely hard keeping the tilt once you started doing stuff with the hands.
So for you, I would probably recommend starting off with maybe 3 rounds of just practicing the full exhale with both hands down, and then maybe slowly starting to throw in the hand lift.
Yeah.
So you cross-reference, cross-stabilize. And then maybe the following visit, I would show you the glute max one. Because let me show you one more thing with this. So stay like that, get back into position. This is where PNF type ideas come in. It's like, all right, I want you to find your left adductor, right? Because I want you to learn how to get in the left stance. So I put this under your knee. That puts you into relative left AFIR.
Okay.
So now set up everything. Good, tucked under, rock forward. Squeeze this knee in. Now push this knee out. You feel how it turns on the adductor? Now you're going to push out at 5 o'clock towards me. There. Now push down. Hold that position. Now take this arm off and reach. So now you got to really push through this leg to get you lateralized. You feel that? So ultimately you're trying to layer on these reference centers as much as you can in positions that the person is able to find them, with the goal of taking them to dynamics.
Oh, I think that these are harder.
But you get, it's cool, like these little lifts that doesn't look like much until you experience it. It's like, man, this is powerful. Just putting a little lift under the knee.
So this is, you're saying AIC?
This is AFIR.
AFR.
So you basically,
Femoral internal rotation.
remember how you,
So stance is on this side.
with left abs and a right glute max to offload the right side.
I definitely have to revisit it.
Cause
So
see,
I feel
remember?
like I was using right abs.
Yeah, you just have to side bend a little bit.
To
And
the
that's,
left.
yeah.
Okay.
And then remember how you're on the wall with your feet on the wall?
Yep.
That's that.
Okay.
So we're trying, like depending on the layers of compensation with a person, you want to get them to zero by doing bilateral stuff. Like a person sucks with both their abs and both their hamstrings. That's why starting here for a person first. Once they master that, then we want them alternating. The goal is alternation. And that's the key. And so far, from what I exposed you to in PRI, it's been mainly the actual neutrality as the goal. But the actual treatment, there's a whole nother. So let's start here.
I bet.